Good time of the day to everyone. This is Channel Miguel, and today we are going to talk about comorbidity and medicine. By the description Wikipedia provides, comorbidity is the presence of one or more additional conditions, often co-occurring with a primary condition. More down-to-earth description would be buy one, get one free, but in this case you're not buying things by your own will. The most famous example of comorbidity is the coexistence of depression and anxiety. Mental disorders often coexist together. It can be considered quite common for them. Some examples of comorbidity. Obsessive-compulsive disorder often coexists with eating disorders. Depression comes with anxiety, and schizotypal personality disorder can be associated with bipolar disorder. Overall, OCD and STPD have pretty high rate of comorbidity, so coexistence of several disorders is quite normal occurrence in their cases. Several different disorders mean differentiated medical help, many different types of pills used. I will tell you about those which I use, how they change my view of life and my life overall. Antidepressants. During my lifetime I have tried many of them, but now I use venlafaxine. It helps to treat my depression, major depressive disorder or MDD, and social anxiety. It literally makes the world brighter to me, as it is known that depression makes our eyes see world in bleaker colors. The same goes with taste, and it makes life more joyous and bearable, and also makes my mood more stable, not allowing me to feel too low. And erases my social anxiety, allowing me to talk to people I don't know, online, offline, and through phone. Neuroleptics. I used risperidone before, but now I use olanzapine. It is used against schizotypal personality disorder and all schizophrenic disorders more widely, and against bipolar disorder, cyclothymia in my case. It helps me with feeling more emotions, from 12% to 52% metaphorically, and be less obsessed with logic and patterns. It also helps against compulsive behavior and maladaptive daydreaming that I suffered from the teen years. Mood stabilizers, anticonvulsants. I used valproic acid before, but now I use carbamazepine. In my case, it treats epilepsy primarily, but also goes as a second-line medication against STPD and cyclothymia. It helps me against seizures mainly, but also regulates my phases as a part of cyclothymia and makes them not so acute and sudden. So my mood changes gradually, and I can predict this change more or less and be prepared. Of course, there are side effects, and some of them are severe when you're just starting to take your pills, like drowsiness, headache, trembling, and so on. But it might be the material for another video. But it will be all for now. Remember, complex therapy is important, and by complex I mean both psychotherapy and medication. You need to help yourself to adapt and survive, and pills are one thing that can allow your psyche and mind to feel better, and overall be more flexible and prepared for the outer world. Goodbye, have a nice time.